Telemedicine is broadly defined as the use of electronic communications and software to monitor and treat patients in lieu of an inpatient visit. Over the past decade, telehealth, a broader term used to define all medical services and health education delivered digitally, has grown steadily as an industry. According to IBISWorld, the industry's revenue has grown 34.7% from 2014 to 2019. The market size in 2019 was around $45 billion, but it's projected to grow to more than $175 billion by 2026. Despite the increase in revenue, Americans have been slow to adopt the practice. According to a 2017 study, 82% of U.S. consumers don't use it. Like all of American life, that changed with the novel coronavirus.
The number of Medicare patients using telehealth has increased from roughly 11,000 a week to more than 650,000 people a week.
It's led to a surge in usage for telemedicine companies such as Teladoc and American Well, and video conferencing company Zoom, whose stock is up more than 150% since the start of 2020. Shares of Microsoft, which owns video conferencing software Skype and its Teams platform, are up more than 14% since the start of 2020. Telemedicine visits surged 50% in March and are on pace to reach 200 million by the end of 2020. That's up from earlier predictions of 36 million. America's healthcare system has skipped the test run and jumped to using telemedicine as a primary means of care during the coronavirus pandemic. Here's how coronavirus could change the future of U.S. healthcare. Telemedicine dates back to the mid-20th century, when radios were used to provide medical advice on ships. In hospitals, the first usage was in the 1950s, through a closed-circuit television link for psychiatric consultations. In the last 30 years, telemedicine treatment has expanded to mental health, stroke, and patients with chronic diseases like asthma, diabetes, or heart failure. A number of research studies found it to be an effective alternative and satisfying for both the patient and provider. Telehealth proponents have sold it as a solution for patients in rural areas. Now they advocate it as a low-cost and convenient option for tech-savvy millennials and busy parents as well. A 2019 American Well study found that 66% of Americans are willing to use telehealth, but only 8% had already tried it. Dr. Michael Barnett is an assistant professor of health policy and management at the Harvard T.H. Chan School of Public Health and a primary care physician at the Brigham and Women's Hospital in Boston. He's published papers about telemedicine adoption in the U.S.
There are many different reasons why the use has been so low. The first is that insurers are very worried that people would use too much telemedicine if they covered it too easily. And so there are lots of restrictions on the kind of telemedicine visit that insurers will pay for. So for example, Medicare, which is the big federal government payer that covers older adults and the disabled, they only pay for telemedicine if somebody is a rural resident. And you also have to go to a specific kind of facility with a specific kind of equipment, and it has to be a doctor that you've already seen. In addition to that, in the US, I think people are really quite attached to seeing their doctors in person. Doctors are also, their business model is very much tied to seeing patients in the office. So they don't have a lot of incentive to offer telemedicine because there isn't really a whole lot of patient demand.